So it's all based on the anatomy. Upper trap, we're going to do a straight side bending, right? And we're going to incorporate the post-isometric relaxation into all these stretches. So on the practical, when we ask you to do an upper trap stretch, don't just stretch them and then look at me like you're done. You're not. You've got to take them, and then you have to do the isometric. Incorporate that into your technique. So the upper trap is going to be straight side bending. Come off the end of the table. Keep going. The anterior middle scalene is going to be side bending, away, rotate toward, and then we're going to do retraction down towards the floor. For posterior scalene, slide back. We're going to stabilize the rib cage, flex, rotate, and side bend away to get the lower three segments, C5, 6, and 7. Okay? Everything's going to have an isometric component. Don't let me move you. You resist for 6 seconds, relax, I take up the slack. Levator, we have to do two things to the scapula. We have to depress it and upwardly rotate it. So we bring the arm up into elevation, which upwardly rotates the scapula. We get on the superior angle, we drive it into depression, and we enhance the upper rotation, and I take the head opposite. What does the levator do? The upper 4 cervical vertebra, it extends, rotates, and side bends to the same side. So I flex, rotate, and side bend away. So the stretch is opposite the action. The upper trap side bends right, I side bend left. The scalene side bend one way and rotate opposite, I side bend away and rotate toward. All opposite. The occipital extensors, we're going to flex the occiput. Just opposite to what the muscle does. And we're going to incorporate the isometric, and then we're going to stretch after the muscle relaxes. All right? All right, let's start. We'll go through each one in detail. Slow down a little bit. Upper trap. Here's what it looks like. One hand under the occiput. I take up the slack on the shoulder, so I lengthen the upper trap. And I say to him, don't let me move your shoulder down. Meet my force. Ready, go. 1, 2, 3, 4, 5, 6. Relax. Let it go, let it go, let it go. I take up the slack. Again, I'm going to try to push your shoulder down, meet my force. 1, 2, 3, 4, 5, 6. Relax, let it go, let it go. I don't take the slack up through the head, I take it up through the shoulder in this muscle, in this stretch. You make sure at all times, you do your best you can not to treat a derangement, but you never know. His pain in through here may be an underlying derangement that you don't see as a derangement. It could be more subtle. So maybe it's there and you missed it. So in the event that it is there, during the technique you always ask, is there any sense of pain going down the arm, going down the chest, going down the shoulder girdle, anything? Any sense that there's peripheralization, there's referral of pain, you stop immediately. You don't want to be flaring up a latent derangement that you missed. And then I bring his head back to neutral. Why slowly? Because these facets are all open on the right. If I bring him back, and that's how we get in trouble at night. We're on our stomach, our head's turned to the right, we're sleeping, and then we turn and we impinge. We don't know it, we may arouse a little bit, but we don't wake up. And then the morning comes, 6 o'clock, it's like, wow, what happened to my neck? Was I in a fight last night? You know, we don't realize that we impinged as we turn back over, sometimes too quickly. Sometimes it wakes you up, but most of the time it doesn't. So when you're like this, don't come back too fast, because you could impinge on a facet. Just come back slowly. Okay? So that's upper trap. The scalenes come off the end of the table. All the way. I come down to T1. We separate the anterior and middle, one technique, from posterior, different technique. Now, we're going to stretch the right side. We're going to side bend him away. We're going to rotate him toward, and then we're going to bring the head and neck into retraction. Because why? The scalenes pull the neck into a forward tilt. So we have to do the opposite. We have to bring the lower neck down towards the floor. I've got to hold one, move one. If I don't have stability, I don't get a good stretch at both ends. So I have to lock the rib cage in. So I'm on the upper rib cage, definitely getting that first rib. I then bring him into side bending left, rotation right, and then I get my, this is kind of tricky, I get my shoulder on his forehead and I retract him down to the floor, and that's why he's off the end of the table. And then the isometric is, don't let me bring your head to your left shoulder. Push back against me. Go. 6 seconds, relax, relax. I side bend. So now I'm stretching through the head and neck. Always monitor. We tell the patient, if you have any sense of pain, discomfort coming down the arm, down the back, down the chest, please tell me. We need to stop immediately. All you should feel is a local stretch right in through here. Okay, 2 or 3 times, slowly bring them back. Posterior scalene, slide down. I stabilize the ribs. I do what I call shot put. It's not a pull. That's more effort. With the biceps, I'd rather push with the triceps. I come underneath and I shot put him. That kind of a movement. So his nose is facing the opposite hip. Stabilize the ribs and don't let me move you. I'm trying to move your nose to the left hip. Push back, 6 seconds, relax. Let go, let go, let go. And I take up the slack. This and the levator are the two you've got to be the most concerned about. This is a lot of tension on the posterolateral disc. And if there's a weak area there, he could derange. So you've got to make sure he's got no sense of referral going down. Levator looks a lot like that. Comes up here. I weave underneath the bridge. Don't do this. You have poor control of the arm. I want you to control the upper limb. Come in, thumb up, as close to the spine as you can. You want to push the scapula into depression, and you want to enhance the upper rotation. And I shot put the head over to the opposite side, nose to the hip. Don't let me move you. 2 or 3 times. Hold 6 seconds, relax, and I take them over to the opposite side. Again, that's a lot of flexion. Be careful of any peripheral symptoms. Slowly, slowly bring them back. SCM is an interesting stretch. It's like the scalene a bit. We're going to side bend, left, rotate right. Then we're going to do a chin tuck. So the 3 components to an SCM stretch. The right SCM will side bend him right, rotate him left, and extend him. So we emphasize very often the side bending, one-way rotation opposite, but there's also the extension on that side. So we have to side bend him away, rotate toward, and then we do a forced couple, one hand on the occiput, other hand on the forehead, and I overturn him into occipital flexion. Again, where's the axis? Running through the ears. Where does the chin go? Towards the hyoid. Now, what's missing with this technique? Because I need my forced couple. I'm missing stabilization. So I have him help me. Hold the side of the table. Good. So now we get some stabilization there. I come in, side bend away, rotate toward, and now I go into a chin tuck. Now there are 2 stretches involving the upper neck. We're going to use the eyes. There is this connection between the eyes and the upper cervical spine. It's bidirectional. When you move your head, your eyes will follow, and when your eyes move, your head will follow. So we're going to get a slight upper cervical extension contraction by having his eyes look up. That'll drive his head into occipital extension. Relax, I flex him, look up with your eyes, and that's going to bring his head up, just the right amount. Relax, 6 seconds, and then I do a chin tuck. Some people have a hard time breathing. When you bring the chin into their throat, they feel like their airway is cut off. So you tell them ahead of time, if you feel that, just raise your hand, and I'll stop. Because if you tell me if you can't breathe, well, if they can't breathe, they can't talk. So just raise your hand if you feel you can't get your breath. Look up with your eyes, 6 seconds, and relax, and flexion. And if you get a nice local stretch, you should feel it right at the mastoid process. And the last one, I'm going to have him hold the sides bilaterally. I'm going to do an occipital extensor stretch. This is great. Bilateral SCM, suboccipital extensors, upper trap, splenius, any of the muscles that extend the head. This is crucial if you want to train the deep neck flexors. You've got to free this up first. If this area is tight, you'll never get the strength anteriorly that you want. You've got to stretch what's tight posteriorly. Again, forced couple, reach down low. I do a chin tuck. Where's the axis? It's running through the ears. Where does the chin go? Above the Adam's apple. And now we're going to use the eyes again, because the eyes will drive the upper neck into extension. Look up. Isometric, you're looking up too hard. Just half of that. Good, perfect. Relax, and I take them into occipital flexion. Look up, I resist, relax, and we flex. Okay? So these are all great stretches on the postural muscles that, according to Yanda, upper crust syndrome, become short, facilitated and short. Traps, scalenes, SCMs, occipital extensors, and levator. Got to take care of these. So we're going to, what's the formula? Stretch what's tight, mobilize what's stiff, strengthen what's weak, and we balance people out.